Rockstars, welcome to Epiphanish, a podcast that will change how you perceive everything. Maybe. And for you to recognise where you have choice and options in your own life. I'm your host and guide, Lisa Westgate, an award-winning mental health advocate, best-selling author, rockstar, life and business strategist of almost a decade, and mum of three. Remember to share this episode and your Epiphanish moment on socials, and please like, follow, share and subscribe on your favourite podcast platforms. Hey Rockstars, welcome to another episode of Epiphanish, and coming to you today with a little bit of a different vibe going on. It's been a really crazy kind of week. I've been having a lot of downloads and thoughts, and there's a lot of things shifting at the moment for me, and for other people that I've spoken to as well. So I'm coming on here today with a bit of a different energy, and I want to have a different kind of conversation with you. And I really feel like now that, you know, we are halfway through season 1, we've done, you know, I think this is probably, I can't remember. I think this is about episode 7. And I feel like we can take the next step in our relationship. And I'm really hoping that you feel the same way. So in today's episode, I am going to be, I guess, really open and really vulnerable in a way that potentially you have not heard me before. And I want to talk about something that for me, it's not new. For me, it is something that I've been feeling and thinking and talking about for years, and just on a quieter, low-key kind of scale. So I've had lots of conversations around this topic, one-to-one with particular people, or in small groups, or with people that I think would receive it in the way it is intended. But I guess I haven't really come out and had this conversation publicly. And the last few days has really become clear to me that I can't not say it anymore. I need to have this conversation in the world, and it is a conversation. It's not, you know, a lecture. It's a conversation, and all of this, I appreciate if this feels a little cryptic right now. It's all going to come together in the next few minutes. But there is risk associated with opening up this potential Pandora's box with you guys, which is why I'm starting with you, my beautiful Epiphanish listeners and subscribers, because I feel like if you've been listening or watching this podcast, you've starting to really get an understanding of me and my philosophies and what I'm really about and what's important to me. And I'm hoping that you can then take that understanding of my experience and where I'm coming from, and take all that into consideration when you're listening to this episode. So to be way less vague about it, what I've been called to raise as a conversation topic is ultimately the level of efficacy, as in how effective is the current mainstream medical model pathway for mental health in Western countries. So obviously in Australia is my direct relationship. I know that there's a huge overlap in terms of what the structures are like and how it works, how the systems work, through conversations and with clients and colleagues in places like the UK, Canada, New Zealand, and other sort of, I guess, those Western countries that kind of run things very similar to how we run things here in Australia. So to outline what I'm talking about, it's really that pathway that says, first of all, that system is reactive, right? In the mental health space, it's a reactive system, which means once you have an experience of or a diagnosis of something like depression and anxiety, let's say, which is really the key two that I'm going to be talking about today. Now that that's become an issue or a problem for you, now that's the point at which you can access services, right? So it's all after the fact. It's once these conditions or situations or circumstances have developed, that's when the door opens to existing services. Now you're saying, Lisa, why would we need them before we need them? The opposite of a reactive mental health system is a proactive mental health system. So you see my first little tangent, and for those of you that follow me know that tangents is a very common occurrence when I'm talking. So a proactive health system, if you think of proactive health and reactive health, let's use the example of heart health and heart attacks and things like that, right? It used to be you just go on about your business in your life, you get to your 50s or whatever, and all of a sudden you'd have a heart attack, and then you go to, you get chest pain, call an ambulance, go to hospital, maybe you get some, stents put in, or they go and clean out your arteries and all that stuff, and it happens after you've had a heart attack. They go in and they look at your heart health and all that sort of stuff, and you get a cardiologist and you get a surgeon, right, all that stuff. What we realized in heart health, and also similarly for brain health and to mitigate the risk of having a stroke, things like this, we realized as a society and as a medical, in the medical world, in that industry, that there is value in proactive medicine, right? So the proactive preventative space in that example is things like, we now know, if you don't smoke, quitting smoking improves your heart health and limits your stroke risk and your heart attack risk. If you minimize your intake of alcohol, if you eat lots of fruits and vegetables, if you regularly exercise for 20 to 30 minutes, 4 times a week, there's all these things that you can do in the preventative, proactive space beforehand, so as to hopefully lower the risk or the chances that you will suffer one of those sorts of incidents, right? Heart attack, stroke, that sort of thing. This proactive approach is used in all kinds of different medicine. We know through research in proactive and preventative health that weight-bearing exercise increases bone density and therefore minimizes or lowers the risk of developing things like osteoporosis, right? So particularly postmenopausal women are encouraged to do weight-bearing exercise. Go lift weights. It's better for your bone strength and your bone density, right? So this concept of preventative or proactive health is not radical. I'm not making up something new that hasn't existed before it came out of my mouth. This model is pretty well established when it comes to our physical health and our physical well-being, okay? It's been funded, it's been researched, it's been proven, there's statistics, there's recommendations from state and federal government, telling us that we should do these things. It's established. My query is, why is a similar approach or investigation or research or considerations into proactive and preventative health strategies not as public, not as mainstream, and not as funded as in the mental health space, right? So coming back to the reactive model that currently exists, now that you have depression, right? You go to your GP, you fill in a couple of assessment worksheets, standardized assessments they get you to do. You know, how often in the last 2 weeks have you felt ABC, right? There's a form. A lot of you will have had to fill it in at some point. And they do these, assessments. And then they say, yep, you tick the box. You've got depression and or anxiety. Here's what we can do. We can organise for you to do some sessions with a psychologist. In Australia, we have a program with our supported medical care in Australia called Medicare, where the government funds certain medical interventions. You can get 10 sessions a year funded, basically paid for, with a psychologist to sort of, a certain financial threshold. And anyway, so that's typically the next step quite often. Potentially a general practitioner might have a conversation with the individual about some medication around depression and or anxiety, depending on what their primary concern is. So they might have a conversation about what medications might be relevant for those conditions, because antidepressants and anti-anxiety medication prescription numbers are on the rise in Australia. So we would presume that doctors are having these conversations with patients and prescribing these medications, because that's how you can get them. And then you go to the psychologist and you do your 10 sessions, and perhaps you see someone privately, and perhaps it is deemed to be a more significant issue, more moving into a mental illness space, in which case we're talking about things like bipolar disorder or borderline personality, schizophrenia, dissociative identity disorder. So, things that are, I guess, further along that mental health spectrum that fall into the mental illness category, as opposed to potentially like a psychosocial mental distress, I guess. And I'm going to attempt to somewhat categorize some of these diagnoses, because currently they all seem to be kind of lumped into a big mental health bucket, and I think that that's potentially contributing to the issue that I want to have the conversation about, which is it is not unusual currently for people to have to wait around 6 months to find a psychologist that has capacity to take on a new client. So people are waiting months and months and months to actually see a psychologist. Then, of course, there is no guarantee that that is the right psychologist for that individual, and that they get on well and they form rapport and they're comfortable, and that's the right person for that person to talk to. So you do have scenarios where people will wait 6 months, get in with a psychologist, not get on well with the psychologist, it's not a good fit, and they need to go and find another psychologist, and they sort of repeat the cycle, and they have to go on another waiting list to find a different psychologist that they feel comfortable, opening up to and having these really big conversations. So that's a problem. In my eyes, that's a problem. Because in that time that they're waiting, they're not necessarily being well resourced in here's what you can do in the meantime while you're waiting, in terms of progress and steps that you can take for your own mental well-being to improve things while you're on those waiting lists. I'm not going to get into a discussion today about the benefits and the, issues or whatever with medication. I do want to be really clear and outline some agreements, and I potentially should have done this right at the start. I want to make it very clear for anyone listening to this that my intention here today in this episode is not to bash any system, individual, or structure that is doing their absolute best in very tough times, right? This is not about shitting on anyone or any, group or system or what's the word, like professional, right? I'm not slagging off psychologists. I'm not slagging off psychiatrists. I'm not, like, my point of view is that there is an existing structure that is currently getting less than optimal results. All right, so let's look at the data. I don't have figures, but I'm going to give you some ideas of things that you could look into if you wanted to. I would encourage you to look at the suicide rate per capita. So per capita takes into consideration the population increase, right? So it essentially per capita numbers negate the changes to population numbers, right? So it kind of evens out the numbers because they calculate for changes in population in per capita numbers, right? So that's why per capita is a better reference mark rather than raw data numbers, so to speak. Anyway, so to get very data technical on you, have a look at the per capita numbers of suicide rates over the last 10 years in this country. Have a look at the rates of diagnoses of depression and anxiety over the last 5 to 10 years. Have a look at the rates of depression and anxiety in particular groups. So have a look at young people, have a look at males over 50. The information is available broken down into segments in the community. Of course, not to mention the metropolitan versus regional figures in these contexts. So the further you get away from major cities in Australia, the worse the situation gets. And of course, remote, rural and Indigenous communities have worse statistics than their counterparts in the city and non-Indigenous. So there's a lot of parameters and different lenses in which you can view the situation currently. Suffice to say, my summation of it is less than optimal. I think regardless of who listens to this or who I get onto the podcast to talk about this with us, I think everyone would agree that we would like the situation to be better. We would like the numbers to be much, much lower than they are in essentially every category that I have mentioned. Right. So let's all agree, for the sake of the rest of today's episode, that the situation is currently less than optimal, right? It's not where we want it. Cool? Let's assume that we're all on the same page. As I said, it's very important for me to make clear I am not interested and not available for any discussion that is binary, right? As in right or wrong, good or bad. That's not a helpful discussion frame, right? And I am not at all saying that the system that currently exists is doing anything wrong. I actually think they're doing a wonderful job under very difficult circumstances, and they're maxed out because there is a piece missing, and that's what I'm going to speak about next, right? So what I want to have here is an and conversation as opposed to an or conversation. So you will never hear me say, oh, everyone should stop taking mental health medications and do yoga instead, right? Like I'm not that person. I'm never going to say that. I don't agree with that. I am a fierce advocate, and have been for many years, of finding the right pieces of the puzzle for you. And for some people that's medication and fucking yoga or kale or, you know, going vegetarian, or like, you know, I don't care if you're, you know, sunning your anus to fucking make you feel better. If that's what's making you feel better, then you should do that, right? Just clearly don't burn that. Oh, that sounds dangerous. Anyway, it's a thing. Google that. Feel free to Google it. What do they call that? Be careful what you Google when you Google that. Oh, there's a specific term for it and I haven't used it. I apologize if you accidentally find images that you did not want to find. Maybe don't Google that. Anyway, I really like even that structure, that GP, psychologist, psychiatrist, even that pathway is really starting to come on board and recognize that an individualization of care is what's required to get the better outcome for the individual, right? For the client or the patient, depending on what system you're in, right? In my world, I call them clients. When I was an ambulance paramedic and I worked in mental health in that capacity and other capacities, they're called patients because that's what they get called in that system, right? Same, the person that needs the support. I honestly, genuinely, 100% am of the belief and the truth that no two people experience a mental health challenge the same way. So we put, you know, labels and we check boxes and we use the DSM-5, or I don't, but that system uses the DSM-5 to give people, you know, diagnoses. And, you know, as you guys know, I was diagnosed with PTSD, anxiety, depression. But these are really, you know, if you imagine, let's call it, you know, depression, it's a label on a bucket, and the bucket is full of all kinds of different symptoms, right? Depression for one person can be quite a different experience to depression for somebody else, right? Depression for one person might be very melancholic, okay, which is a kind of an old word. You don't hear it much anymore, but it's like a profound sadness. And they might spend a lot of time crying and, you know, listening to a lot of The Cure. I don't know. I'm not making any generalization. That's probably my 17-year-old version of melancholy. But it's that sort of feeling of there's a sorrowfulness in melancholy, right? Whereas for a lot of other people, depression, in inverted commas, right, same bucket, same label, is predominantly a feeling of numbness, of disconnection from themselves, from the world. They kind of feel like they're zombieing around, and they're kind of really not connected to their life experience, and they're numb, and their emotions are numb, and it's all just very flat and grey and kind of, you know, 5 out of 10 across the board. Like, it's just, you know, everything's very average. And that's their experience of depression, right? So I think it's an important distinction and understanding to have, that what one person refers to as depression is possibly not the person next to them's experience, even though they may have both at some point in their lives had a period where someone has said, oh, you have depression, right? You're depressed. We're not all necessarily talking about all the same thing all the time when we're using these words. Cool. So again, the system that is currently in place is absolutely doing its best, and there are individuals within those systems that are absolutely phenomenal, and I have no doubt that there are people's lives being saved through that pathway. No doubt at all. And that's why, like, I'm not condemning anything. And I know I'm repeating myself, but I really want to be very clear that I'm not shit canning anything. In fact, what I want to propose and what I really believe needs to occur for everyone's benefit is coming from a point of view of expansiveness. What if there was that, and what if those people that had to wait 6 months to see a psychologist could access a range of other options and choices to improve their well-being, their sense of purpose, their sense of fulfillment in life, and other aspects. And then potentially, when that psychologist appointment becomes available, they don't need it, and someone else can take their place and access that support that is, overrun, right? There's, a long list of people waiting for every appointment. I feel like the system that exists under the banner of mental health, and I've sort of outlined what I'm talking about, is ultimately designed for the mental illnesses that I spoke about earlier. So I guess those, more, I don't want to, it's all significant, right? So I'm not going to say significant because it's all significant, and everyone's experience of mental health challenge is challenging for them, right? So this is not a rating system. I'm not minimizing any one person's experience over another person's experience. And you guys have heard me talk about a lot before, right? That there's no competition in this space. It's not a race to the bottom. It's not who has a worse time, right? Having said that, the system that is currently struggling and overrun and full of long waiting lists and not enough people in that system to handle the demand was designed and created for a mental illness issue, right? Those units and the psychologists and the psychiatrists are trained in neurochemical imbalances, in complex mental health conditions, like I said, such as bipolar disorder, DID, schizophrenia, psychosis, the extremes, I would say, of mental illness. And I ask for your forgiveness in the language I'm using. If I'm using a language that you don't feel is accurate or correct, I apologize. It's just because I can't think of a better word right now, but I really want to make it clear that it's I'm not what am I saying? Like, I'm not minimizing anyone's experience regardless of what their mental health difficulty is when you're in it. But there is a difference between mental illness and what for some people and some people's experiences is more of what I might refer to as a psychosocial mental health challenge, or in some cases related to the circumstances of that individual's current existence. I'm going to give you a specific example. Quite a few years ago, quite a few years ago now, maybe, 7 years ago, I had a client come to my office to work with me, and he stated that he was suicidal. And I said, okay, well, let's explore that. So first of all, it is very important for anyone that vocalizes that they are taken seriously, that is taken on face value, and that it is accepted as fact at the initial point, right? So anyone that discloses to you that they are suicidal, that they're having thoughts of suicide, they have a plan, anything related to that must be taken seriously and must be assumed to be 100% true. Okay, so that is a very clear statement I want to make about anyone that expresses that, whether it's to a friend, a loved one, a peer, or a professional, right? So anyone that states anything essentially to do with suicide has to be taken seriously. Okay, I assume that you're being genuine, right? And I make that statement because there was a time in our past where people would not take that seriously, and they would dismiss or ignore those sorts of statements, with obviously dire consequences in some situations. We as a community have progressed, and that we now understand that, as uncomfortable as it might make us to hear that from someone that we care about, it's really important to acknowledge it very seriously and have that conversation, right? Have a further conversation. So I had this client come and disclose to me, in his words, sometimes I'm suicidal. And I said, okay, thank you for telling me that. I appreciate you feeling comfortable enough to tell me that. Can you tell me some more about that? When does that happen? What are the thoughts around that? And we had a conversation around that presumption that what he was telling me was, statement of fact. And essentially what we elicited and what we came to realize through compassionate and curious questioning, right, because that's my job, was we explored that in a supported way. Okay, so I'm not asking anybody questions around that with any sort of pretense of accusatory tones or minimizing what they've said. There is a way to have these conversations in a supportive and appropriate and compassionate manner. And hopefully, if you're not sure how to have those conversations, then find a resource and find out how to have those. So, or refer them on to someone that you feel has the capability to have that conversation at that level. Right. And I hope you appreciate, I know that this story is getting very interrupted, but I've really got to be clear about the caveats that I'm putting into this and the framework in which we are having this conversation today. And as I said at the beginning, this is potentially vulnerable for me to speak to you about this, because not everyone is going to agree with my perspective. Not everyone is going to be on board with what I say, and I might cop hate or whatever, and I have in the past, but I think it is more important that we have the conversation, and I will manage whatever comes my way from it. What was determined through this conversation with my client 7 years ago was that in his individual circumstance, he was experiencing some anxiety at his workplace, and so he did not feel safe and comfortable in his workplace. His living situation was less than optimal. He was living with housemates that were also not supportive and not making his home life situation all that great either. There were some other factors in terms of, the car he was driving, how much sleep he was getting, his physical health, how he felt about his physical form, right? And how healthy he felt he was. And so there's a number of factors that you know, well, the job and the house and the car and the this and my body and, you know, and therefore, sometimes I feel suicidal. Okay. I appreciate that. And again, I thank you for being honest and feeling comfortable enough to have this conversation with me. Let's play a hypothetical, right? Let's say your job was a safe place to go, you felt supported, and it was fulfilling for you. Your home life was comfortable. Your home was your sanctuary. Perhaps you live alone. You can come home and really just relax and let it all go and be yourself. You get the repairs done to your car so that you're not too worried about that. You start eating healthy and going to the gym. Perhaps you adjust your body to a healthier weight range and you feel healthier in your body. If those were the circumstances around you, him being in the center, would you still feel how you feel now? And he said, well, no, like if I had a great job and I had a girlfriend and my home life was awesome and my car was fixed and whatever, I would not still be suicidal. Life would be awesome. Okay, cool. So would it now be okay for us to explore how we can make adjustments and changes in these circumstances around you to move you further away from where they are now and closer towards where we want them to be, where you don't feel suicidal? Would that be okay? Yeah, that would be okay. Let's have that conversation. Okay, great. And then we worked on each of those elements and we, put plans in place and we set goals and we changed some thinking and we changed some behaviors and right. And so what we identified was, again, in this individual circumstance in which I'm speaking to you about and using as an example, this is not the case for anyone else except this one person. What we identified was that there were circumstances contributing to a low mood and mental health challenges such as depression, anxiety, and suicidality in his case. Right, so what if the people that could identify that their challenges with feeling fulfilled in life, living a lifestyle that they want, achieving the things that they want, setting and reaching goals, feeling valued and loved and worthy within themselves, being present in the now. What if those people that resonated with that stuff that I was just speaking about, what if they could access a range of other avenues of support and other pathways outside of the existing structure of GP, psychologist, psychiatrist, maybe some medication, like that as the mental health pathway? What if, in addition to that, there was a range of choices, offerings, practitioners, methodologies that were more known as being accessible, that if you wanted to go and explore some of those things for the benefit of your mental well-being, that you could try some of those things, as well as, or whilst waiting for an appointment potentially in this pathway. And apologies if you're just listening to this, I'm absolutely talking with my hands. Where would the risk in that be if people could use that time to potentially get to know themselves, know their values, find their purpose, and better themselves in that space? And maybe even a small percentage of them would end up not needing the services that are currently overrun and understaffed. Wouldn't that be better wouldn't that be good for everybody, for the individual and for the system that is stretched currently? I want to raise this conversation and put myself out here, and like I said, potentially not everyone will be on board, because I really think that we as a humanity need to start looking at mental health, and the mental health structures that we have in place from a much broader perspective that provides more options and more choice for that individualization of well-being. Because we know, CBT doesn't work for everybody. Talk therapies doesn't work for everybody. DBT doesn't work for there's no one thing. I mean, even within that framework, there's multiple, therapies that are used. So wouldn't it be even more beneficial for people that are looking for support and looking for solutions to start having these broader conversations around things that are available and, in a lot of cases, incredibly effective, that reside outside of that one pathway? One of the big differences, and this is potentially controversial, but I've said it now, so if you want to approach me and have a further conversation about things that I've said that maybe have challenged you or that you disagree with, again, I'm happy to have the conversation. I feel like, and I say I feel, but this is really coming from, around nearly 10 years in this space, not including 10 years working as an ambulance paramedic. And obviously I had mental health related experiences as a support person in that career as well. Taking all of that into account, I would encourage anyone who is being challenged by a difficult period in their mental well-being to consider the question, where does the power lie? In your situation, where is the power? Who has the power to create change? In my experience and my perspective, we can think that we need to seek a fixer. We are broken. I certainly, absolutely saw myself as broken. 9 years ago when I had my diagnoses collection. Absolutely. I self-identified as broken. I had people argue with me, but that's how I felt. And at the time, I believed that I needed someone else to fix me. I need to find the right therapist, or I need to find the right balance of medications, and that over there, external to me, that will fix me. And what I have come to the realization, as I said, over the last decade or so, is that in fact, you can access supports and resources. So that might be things like different therapists and medications. Again, I'm not demonizing anything. It's all part of the solution, right? When you are of the belief that those things external to you is what's going to fix you, my belief in that is that that is a disempowered state. You're giving the power to the medication or to your doctors or your treatment team or whatever, right? That it's their role or job, or it's that thing that is going to fix me. And after a decade on my own journey through all of this and supporting my clients through all of this, if I can really leave you with a key takeaway today, it would be that the power lies within you. The power lies with you. You can go to a therapist and not take on board anything that they say. You can be prescribed medication and not take it. That thing external to you is a support and a help. But ultimately, the power lies with you about whether you want to make the change, whether you want to, it's what you choose. You have to choose change. You have to choose, in my experience, you have to choose uncomfortable for maybe a while, because it's not easy. It's not like a cruisy process. There is almost always, I can't think of any scenario where there's not, a good period of uncomfortable. And that's because staying in the zone that we are familiar with, the comfort zone, the familiar zone, the current circumstances, is what's making us feel the way that we don't want to feel anymore. So to feel a different way, we've got to go outside of that zone of comfort or familiar or whatever you want to call it, right? And outside of the comfort zone is therefore by definition uncomfortable, right? Or unfamiliar. That's the scary space. So the number one choice for anyone that is looking to overcome or outgrow their mental health challenge is you've got to be ready or willing, not even fucking ready, right? Because who's ready? No one's ready. You've got to be willing to choose uncomfortable, unfamiliar, scary, change, unknown for a period of time. And have the mindset, okay, well, it might not be nice, but I've got to give it a go. Because right here, what's happening right now is not okay anymore. I have to do something different. Now, do I have a double-blind research study with, I don't even know, right? Placebos and controls and whatever to say that how I work with clients, that self-development, that doing the inner work around learning who you truly are and what you value, and then coming into living into alignment with all of that is beneficial for your mental health. Do I have a, anonymous longitudinal research study that says that? I do not. I do have clients that will tell you that it works, that it worked for them. And more importantly, what we do have, like I said at the beginning of this episode, what we do have is a lot of data and a lot of figures and a lot of research that what we are currently doing in the mental health space, the current pathways and options, is giving us as a community a less than optimal outcome. Suicide numbers are not decreasing in any significant way that we would like them to. Rates of diagnosis of depression and anxiety are going the wrong direction. So what more does it need to take for us to see that it is time to start looking at things from a different point of view, from a different perspective? What else can we be doing in adjunct to the current systems and the current reactive structures that exist? What can we do as well as over in a different space? What can we do in the proactive space? What could we do if we upskilled people to learn how to manage disappointment or losing a job or losing a friendship? Or, how do you cope with challenges in your life that you are inevitably gonna deal with? Relationships break down. We lose jobs. People around us pass away. What if we upskilled our humans to be better resourced, better equipped to handle at least the known knowns, at least the predictable parts of life? You're probably going to get fired from a job at some point in your life, right? How you handle that, what it does to your mental health, what you make it mean. There is absolutely room to move in terms of changing how we perceive these life events, right? Are some of them still fucking awful? Yeah, of course they are, right? I'm not saying they're not going to be, but how long do you stay in the awful? How much does the awful affect other parts of your life, right? There's so much variation and flexibility in how we as human beings manage the circumstances of our existence, that in my mind, if we better resource and we upskill people at all stages of life, surely it's a straight line between better resourced human beings and mitigating some of the risk of developing things like those psychosocial challenges like depression and anxiety. Again, not mental illness, clinical depression, bipolar. That's really not what I'm talking about, okay? That's what that system that's currently there was designed for. That's what it's set up for. That's what it's there for, right? But we currently have a global epidemic of mental health challenges because people are finding life difficult and overwhelming. And there are certainly aspects of that that can be supported and better resourced through other pathways. Wouldn't it be great if we could take the pressure off that very specifically set up system by supporting a cohort of people in a different environment? Wouldn't that be great? Because then this side of the equation, on the reactive and mental illness side, could just get on and do the work that they're designed to do, right? And to a lesser extent be swamped by people looking for answers that don't know where else to look for answers. I'm going to wrap up because I'm going to start repeating myself and increasingly ramble. I just really want to finish up by clarifying that my intention on today's episode is to inspire a different level of conversation around mental health and mental well-being in this country and others that goes beyond sending more money to the major players in the existing system. I think we need innovative thought around mental health as an industry, as a segment of healthcare. I think we need to start thinking about these things differently and having different conversations about how can we increase the options and choice and have a more expansive array of options for people to select, for people to try and see if that's the thing for them. And even if we took, even if 1% or 2% of people that are currently challenged with depression and anxiety, for example, unfulfilled, unmotivated, don't know what their purpose is in life, aimlessly wandering around, not making the progress, not where they thought they would be by whatever age they are at, whether it's 25 or 55, right? If we took 1 or 2% of the people that are currently pressuring the existing reactive system and we found them solutions elsewhere, that they never had to come back and, take up that psychology appointment. They didn't need to engage with those services because they found their solutions elsewhere. Even 1%, wouldn't that be great? Wouldn't that help relieve the pressure on the current system? And it would help 1%. That's a lot of people. That's a lot of people that would be helped and would be beneficial. And their partners and family members and kids and parents and workmates and colleagues and their clients, We all have our circle of influence. Whether you know it or not, you have a circle of influence. There are people around you that you are influencing. And then there's people around them that they are influencing, right? So your circle of influence, you are the rock in the pond, and your ripples go far more than you think that they do. So if we can support 1% of the people that are currently looking for solutions by expanding the pool of options and making known and accessible some other pathways that might be the thing for them, wouldn't that be really great? Shouldn't we give it a go? I'd really love to hear your thoughts. If you're watching this on YouTube, please put something in the comments. If you want to have a more personalized conversation with me, you can always check the show notes. My social links and my email are in there. Please reach out to me if you want to have a conversation about this directly for yourself. If you are in the mental health space and you are also keen to look at innovative solutions and you're interested in thinking differently about the issues that we as a society have, if you're passionate about mental health in young people, if you are passionate about men's mental health, if you are passionate about, you know, any aspect of this huge area, and you'd like to have a further discussion with me about the specifics that you work in and what we could potentially open up in terms of possibilities of solutions for your specific focus, then please reach out and let's have a conversation. Because, like I said, do a quick little Google, get around the numbers, and I think we can all agree the situation is currently untenable. It's not sustainable. It's less than optimal, and it's time to do something about it. I trust this has been useful and you have received it with the intention in which I have sent it out to you. If anyone is upset with me, feel free to contact me. I'm happy to discuss it with you. Again, it's not about convincing anybody or swaying anyone to my point of view. I just think it's really important for us to start having these conversations. Thank you for your time today, and I look forward to seeing you on the next episode of Epiphanish.